Hi, good afternoon. My name is Natalie Villegas, and I will be performing the thorax and cardiovascular assessment on my patient. So this is my patient. So before doing the procedure, is you have to make sure to do the basic hand washing or disinfecting your hand before touching the patient. So here we have alcohol. And then just clean your hand using the alcohol. So before doing the procedure, you have to introduce yourself to the patient, and also you have to inform the patient of what type of procedure you're going to perform. So, hi, ma'am. Can I get your name, please? Ashley Chubet, and your age, please?
20.
20. All right. So, ma'am, I will be doing the thorax and cardiovascular assessment on you. So, are you okay with that? Okay. So, since the patient agreed on the procedure, so you can now proceed. So, first is the first step is to use um, the ball of your hands or your palm area, this one. So you press it against the patient, like on this part and this part. So ma'am, let me do the assessment on you. So here, if you can see, then so um, so what I did earlier with the patient is I used the ball of my hand, both of my hands. So you don't have to like do it like in the same at the same time. So first is you have to touch the clavicular area, and then the aortic area, and then the pulmonary area of the patient. So the next procedure is to use your stethoscope. So first is to use the bell part of the stethoscope. So this one, the bigger part. And then you have to listen to the S1, the S2, S3, and S4 sound. So let's proceed. So as you can see, and that's it. So the next part is to use the bell part of the stethoscope to listen to the S1, S2, S3, and S4 again. So do the same procedure, but using the bell part of the stethoscope. So far I didn't hear any murmuring sound or any abnormal sounds from the patient during the assessment. Thank you. Hi, so the next procedure or assessment is the thorax and respiratory assessment. So this is my patient. So in order for us to explain it to you well, so we've decided to just have the patient or our client in a sitting position. Okay, so first, when you are going to check for any dullness or like tenderness or like abnormal sounds or like feeling, um, and again you have to use the palm of your hand or the the ball of your hand. So do this from the clavicular area. So the positioning or the root of the what do you call this, of the procedure is here, here, and here. Imagine the number 3 here, here. 3 number 3s, or no, 2 number 3s. So first is here, you check, you can feel it, and then here, in the near the or close to the arm second intercostal space. Then here, the mid clavicular space. Then here, and then excuse me, ma'am, and here. So far, I didn't feel any tenderness or any abnormalities from the patient's body. So next is we will, or we're going to use the bell of the stethoscope. So let's continue with the procedure, ma'am. So the location is from the clavicular area, again, of the patient. So from here to here, here to here, and then here to here, and then on the apical part, or the armpit area of the patient. So here, can you raise your hand a little bit, ma'am? And then the mid clavicular part. Same thing with the other side. And then the last procedure for this assessment is we are going to use the bell of the stethoscope. So same thing, same procedure. From here to the clavicular area. 1, 2, and then here, and the mid clavicular area. So you have to do the same thing on the other side of the patient. Thank you. Hello everyone. So the next procedure is to assess the abdomen. So this is our patient, Ashley, and we've already introduced ourselves to her, and also we have already explained the type of procedure that we'll be doing on this moment, or at this very moment. So the first step when you are assessing the abdomen is you have to picture your patient's abdomen in 4 quadrants. So first is you have to stand on the right side of the patient, and then you have to look at the abdomen from the side above. And then from the xiphoid process to the symphysis pubis, determine whether it is flat. So from the xiphoid process to the symphysis pubis, you have to check if it is flat. And the scaphoid should be rounded or protuberant. Now, if it is protuberant, ask whether this is normal for her. So it's not protruding, so it's normal for her. So there's no protrusion visible, or any visible protrusion. And as I mentioned, if it isn't, then assess to distension of the ascites during the percussion and palpation. So next is to assess for any visible mass, bulging, or any asymmetry. So look for unusual coloring or scarring or scar, stray lesions, petechiae, ecchymosis, spider angiomas, and suspicious looking moles. So inspect the umbilicus too by using your the pen light. By using the pen light. So you have to direct the pen light on the patient's abdomen to check. So, and also note if there are any hernias. Look at the pulsations of the patient's abdomen, and if you won't see any you won't see on any of most patients, but in a thin patient you may see any pulsation or the aorta in his epigastric area, and possibly peristatic waves. But our patient is healthy, like she's kind of bulky, so there's no any peristatic waves and abnormal or like any epigastric pulsation. Then so next is we have to auscultate first. We have to check the abdomen of the patient using the diaphragm. So you have to place the diaphragm of your stethoscope lightly over the right lower quadrant and listen for any vowel sounds. So if you don't hear any, just continue listening for 5 minutes within the quadrant, then listen to the right upper quadrant, the left upper quadrant, and then the left lower quadrant. Then describe any vowel sounds or absent, normoactive, hypoactive, or hyperactive. So absent vowel sounds may indicate ileus or peritonitis. Hyperactive vowel sounds may occur with an early intestinal obstruction of the gastrointestinal hermotility. So let's do the procedure. So divide the abdomen of your patient into four. So into four quadrants. And then auscultate using the diaphragm. So far I didn't hear any hyperactive vowel sounds on the abdominal area of the patient. Now the next procedure is to use the bell of the stethoscope. So you have to listen over the aorta and also the renal, the iliac, and the femoral arteries of the patient. Now if the patient has hypertension, you may hear a bruit or a vascular sound similar to heart murmur. It could be caused by turbulent blood flow through a narrowed artery. So occasionally you may hear a bruit limited to systole in the epigastric region of a healthy person. So do the same thing, but using the bell of the stethoscope. So this is the bell of the stethoscope, the small one. All right, so that is on how to check the abdomen of the patient using the round or the palm of your hand, the diaphragm of the stethoscope, and also the bell of the stethoscope. So hi again. Now, what we're going to do, step 4 is to lightly percuss all of the 4 quadrants of your patient's abdomen. So you will hear dull sounds over solid structures such as the liver, and fluid-filled structures such as a full bladder. So air-filled areas such as the stomach produce tympany. And dullness is a normal finding over the liver, but a large dull area elsewhere may indicate a tumor or a mass. So you have to watch for it. So remember, you have to divide it into 4 quadrants. So you have to percuss using both of your hand like this. Check for any mass or abnormal bulging. So that's it. Like remember, if it is a liver, so you'll feel a solid structure, so that is normal. And if it's a filled fluid structures, like a full bladder, then that is normal as well. But if elsewhere, like it would indicate a tumor. So if there's any tumor or like mass felt during the assessment, then you have to create a report or escalate it to the doctor. Now, so well, it is also very important to assess the respiratory or the respite of the patient. So this is the anterior, which is the front. So we already inspected it earlier. Now this is the posterior part of the patient, where we can find or where we will be performing the respiratory assessment. So first is to use the ball of your hand or your palm in checking. So you have to start to the C7. So from the C7 to T3, and then from the T3 to T12. All right. So first is use the ball of your hand. Just one. One. Okay, and then after doing so, next is you use the diaphragm. Okay. And after that, so I didn't hear any abnormalities. So let's use the bell of the stethoscope. So everything seems normal and there's no any abnormal sound. So that's it for the respiratory assessment. So the next assessment is to check for the normality of the upper extremities or the upper extremities assessment. First is we have to check for the color of the of our client or our patient. So check if the color is normal, if it's jaundice, or if it's pallor, or is there any abnormalities of the coloration of the patients. And also you also have to check for the mass if there is any like bulging mass. So as you can see, like everything is normal regarding when it comes to the color, and there's no any visible mass check or seen on the patient's arm. And then next is we have to check the condition of the nails, the color of the nails. So all you have to do is to pinch it, and if it goes back to color red or the normal color, then it is normal. And if it doesn't, then there's something wrong with the patient's nail. So next is you have to make the patient identify. So you have to draw on the patient's palm. So ma'am, can you close your eyes? Can you please identify? Number 2. So the patient is able to identify the number that I draw to her palm. And the next is you have to check if the patient can identify the object that you'll be placing on her palm. So ma'am, can you tell me what object you're holding? It's a coin, correct. So once the patient is able to identify the object, you have to proceed to the next assessment, which is to check the dullness and the sharpness of the object. So since we don't have any other sharp objects here, so we'll just pretend that this is a, let's say, a cutting tool. So this is the sharp part of the cutting tool, and this is the dull part. So ma'am, can you please close your eyes, ma'am, and identify which part of the tool I touch your I am like touching your skin.
Okay. Sharp.
So it's sharp. How about this one, ma'am?
Yeah.
It's dull. So the patient, she's able to identify the dullness and also the sharpness of the object. And then next is the test tube. So the patient has to identify as well the temperature of the test tube. So let's pretend that this test tube is in a normal temperature and the other one is in a higher temperature. So ma'am, this is the normal temperature, and this is the hot test tube. So this is the cold one, this is the hot one. Can you please close your eyes and identify if it's hot or cold?
Hot.
It's hot. And this one, ma'am?
Hot.
So the patient, she's able to identify the temperature of the test tubes that I am holding. And then next is you have to have the patient feel a sensation. So use the cotton ball. Can you feel anything, ma'am?
Yes.
Can you identify the object?
That's a t-shirt.
Okay, thank you, ma'am. And then next is you have also to check. You have also to check the brachial pulse of the patient. So it has to be like 3 centimeters from the patient's wrist. So far it is normal, and So next is you have to check if the pulse sensation of the brachial artery and the radial are in tune. So you just have to do this, like it's just very simple. Yes, it's normal. They are in tune. So next is I will be pointing my finger to the patient's arm, and I'll have her point which part of her arm I did place my finger. So can you please close your eyes now? Can you do it now? Okay, thank you. And next is we have also to identify if the patient's hand movement is normal. So first is you have to make sure that the knees are close to each other, and then let the patient do this test. Thank you, ma'am. So as you can see, it's normal, and the patient wasn't shaking when she was doing the procedure. So both hands are in symmetry during the movement. So, ma'am, the next thing that we're going to do is, can you please touch the finger touch? Yes. You have to check if it's like the speed is equal, and there's no shakiness, and there's no abnormality of the movement. So far it's good. And then so next is the finger to nose assessment. So ma'am, can you do the finger to nose assessment? Thank you. And next is have the patient do the like open her arm, and then ma'am, can you touch your finger, your nose, doing that position like this. Thank you. And yes, that's it for the upper extremities. So the next assessment is to assess the client or the patient's lower extremities. So first is to check for the color and the mass. So as by checking the patient's legs, it doesn't show any no mass or masses visible, and the color of the patient's skin is normal. So it's not jaundice, it's not pallor, and also the skin turgor is normal. And then next is to check for the popliteal pulse. So all you have to do is to bend the patient's knee a little bit, not too much, and then locate the popliteal pulse of the patient. So check for the beat, for the beating, if it's normal or abnormal. So do the same on the other leg. And then next is you have to check for check the Achilles tendon. So ask the patient to bend the leg and then locate. And the next procedure is to check for the dorsal pulse. So here, this is the dorsal area of the patient, so check for the dorsal pulse. And do the same on the other leg. Then next is to check for the So next is to check for the tibial pulse. So ask the patient to bend her legs a little bit if you can't locate. This is the tibial area. Okay, thank you, ma'am. Then next is to check for the hair sensation. So ask the patient to move her legs against her other leg or her toe to her left leg. Can you do it, ma'am, please? Can you sense the hair of your legs, ma'am? Thank you. And then the next part is to have the patient stand up. Ma'am, can you please stand up? And do the Rumbudge test. So let's stand up and ask the patient to walk towards you. Not yet. How do you make go back? No, like back ba? Oh, ano idea. Okay, just like that. All right, so just have the patient walk towards you and make sure that the patient walks on a straight line and not limping, or there's no signs of dizziness or nauseous feeling. Can you walk towards me, ma'am? So far, the patient's walking gait is normal. So there's no indication of nausea or abnormalities of her balance. So the last part of the assessment is you have to ask the patient to close her eyes, and you have to check if the patient will fall or if there's any abnormal movements while she's standing while her eyes is closed. So can you please close your eyes, ma'am, and we'll check your balance while your eyes are closed. Okay, thank you, ma'am. So that's it for the lower extremities assessment.